Hi, my name's KK. I'm going to be performing 4 special tests for you today. I'll start off with the intermetatarsal neuroma, then I'll move on to the anterior jaw test, and then to the Kleiger's test, and finally finish up with the forefoot stress test. So starting off with the intermetatarsal neuroma, typically patients come in with pain when they have really narrow or tight shoes. They'll describe the pain kind of at the ball point of their foot. Typically, I'll just start off with doing a squeeze test just to rule out any fractures. Then I could perform the Mulder sign test, where I simply squeeze the foot together and use my other hand to pinch in between the metatarsals. If there is pain, that is a positive sign of intermetatarsal neuroma. And then another test I could do for that, if there's a pencil or a pen handy, I could use the tip of it and simply just put some pressure in between the webbings. Very common in between the third and fourth metatarsal especially. And moving on to the anterior jaw test, I'll just have my patient have their knee flexed, hanging off the table. We're just checking for the anterior talofibular ligament. All I would have to do is just stabilize the lower part of the leg, use my other hand to cup the heel. I will use and pull gently moving the talus anteriorly. It is a positive test if it gives a lot of laxity. There should be a 3 to 5 millimeter difference between this foot and the uninjured foot, showing that it's a positive test. And then moving on to the Kleiger's test, very similar to the anterior jaw test, but this time we are checking for either a deltoid ligament injury or a tib-fib syndesmosis. We're just going to add a little bit of an external rotation to it by stretching the fibula. By moving the fibula laterally, we'll be stretching the syndesmosis, separating that, and stretching the deltoid ligament. So to check for the deltoid ligament, I'll just put the foot in dorsiflexion, and I'll do the same thing. I'll just rotate it externally, checking if there's any pain on the medial side, giving it a positive sign for deltoid ligament injury. And then for the tib-fib syndesmosis, I can either put the foot in plantar flexion or leave it in neutral, and do the same thing by giving it some slight external rotation. If there's any pain on the lateral side here, could be a sign for a positive tib-fib syndesmosis injury. And moving on to the last injury or test that we have is the forefoot stress fracture, kind of checking if there's any fractures here in the metatarsal shafts. Very common for patients to have some swelling here towards the top on the metatarsal bones. Like I said, very common for the second, third, and fourth metatarsals. All I would do is just keep the foot here. I will do a long bone compression test on each metatarsal bone. If there is pain anywhere doing that long compression test, it could be a positive sign for a stress fracture on the metatarsal bones.